Well, I work on my feet all day, and I would think that when my legs would start hurting, and I would always think it was time for me to get a new pair of shoes. So I would get a new pair of shoes, and I'd be okay for a little while. I could go pain-free. It was getting shorter and shorter to the point where I got new shoes, and I would walk 10 steps, and my legs would start hurting again. And this went on for like 4 years. So I finally said, I can't take the pain anymore. My name is Victor Macri, and I've had both of my hips replaced this year at Community North. Community North sort of chose me, which I feel like I fell into the lucky pool. I had my left hip done about 8 months ago, and my right hip was done just 4 months ago. When I went to Dr. Feliciano, my very first question in the 430 questions that I asked him was his knowledge of the anterior approach, and that's his specialty. Anybody I talk to, what they will say is, isn't he wonderful? So, and he is. He's happy to answer any questions you have. And I was given an instruction book, sort of an instruction Bible of everything that's going to happen 6 weeks, 4 weeks, 3 weeks, a week before surgery, what to expect, what you should be doing, the exercises you should be doing. It was something that I just always carried around with me, looking up what procedure was going to be like and helping me just know what to expect at each step along the way. My physical therapist would come over 3 times a week, and then I had occupational therapy twice a week. And then I'd have a nurse coming to my house twice a week for a blood draw. And it was extremely helpful, especially the second surgery, to have the nurse coming over just to help me with changing my bandage on my leg and answering questions I might have, and just checking my health. I think that's the thing about Community North, or community, that I just really appreciated was there's a process that it's just you just don't go in for surgery. You have a class before your surgery, and you meet other people that are having either knee or hip surgeries, and you sort of go through it as a group. Sign up to volunteer, and I've been volunteering for the last month at Community North, working with joint replacement patients, doing for them what was done for me. I want to do something to repay for my experience. If you're having trouble walking, I see people all the time limping, and I always want to say, do you need a hip replacement? I would say, you go to your doctor and find out what the problem is and take it from there. And don't be afraid, it's amazing. I get to the point where I couldn't climb stairs. I work for a supermarket, and I could not walk through the store without holding on with both arms to a grocery cart. I would walk all day with the grocery cart. I've had cold season tickets since 1984, and I go to all the games. Last year, I couldn't. I go with one of my best friends, and I'd have to use her as a prop to like a crutch to help me get it just walking down the street. I couldn't walk down the street without putting my arm around her. Now I can do anything I want. I mean, I can run through the store. I can go to the Colts games and not have to worry